Good evening, everyone. I'm Sayukta from Beautiful Spotless Skin Team, and I'm sure all of you must be keeping good health. Misuse of topical steroids are the widespread phenomenon among young people in India, especially women. Viewers, as you know, many people are using cosmetic products, mostly fairness creams, without even knowing what products contain. That these products contain steroids and assuming that they will get fairer and have a glowing skin. But they do not know that inappropriate use of steroids may actually cause severe side effects. According to a study done in 12 various Indian cities, the findings are that almost 60% of all patients who had skin problems on their face were using creams containing steroids without any prescription. That means without consulting a doctor. Side effects of this abuse were seen in the form of growth of facial hair in women, worsening of pimples, thinning of skin, causing severe sensitivity to sunlight. The practice is associated with significant adverse effects and poor awareness of these effects among the general public. To keep you informed, and today for this, we are here to know about the misuse of topical steroids and how to be aware of it from an expert. So let's connect today with our skin expert, Dr. Aliza Zaidi, live from Lucknow. Dr. Aliza Zaidi, MD, is a dermatologist and entrepreneur based out of Lucknow. She has medical experience of more than 5 years. Dr. Aliza holds an MBBS and MD in dermatology from ERA's Lucknow Medical University and Hospital in Lucknow. Dr. Aliza's interests have always been to provide her medical expertise and services to anyone and everyone who needs it. Dr. Aliza is also active on social media, where she regularly shares information on dermatology, health, and wellness. Dr. Aliza Zaidi currently practices at Dermacore Skin Hair Laser, Gomti Nagar, Lucknow, and is also the Vice Chairperson, Department of Dermatology, Chandan Hospital, Lucknow. A very warm welcome to you, Dr. Aliza. It's a pleasure to have you with us.
Thank you so much. I'm glad to be here and ready to impart the knowledge, of course.
Definitely, Doctor. It's a sheer pleasure. And as we are trying to raise alarm for the misuse of topical steroids, and I think it's a very important topic to discuss because, most of us are not very much aware of the abuse that these steroids can do on us. And we can easily, because, chemist shop over-the-counter medication is so easily available in our society that most of us fall prey to that, and we end up worsening our symptoms, thinning of skins, etc., etc. So first of all, we would like to understand that, Doctor, why we are not supposed to use creams or formulations containing topical steroids, especially without any prescription.
See, as you rightly said, especially without any prescription, steroids are given in some dermatosis of the skin. In some conditions, we as dermatologists, with with very diligent discretion, we do give topical steroids. But yes, without prescription and without even consulting a dermatologist, it has hazardous effects. See, basically all the corticosteroids, they are in a category of highly superpotent to least potency. They are mild, they are moderate, and they are severe. So generally the off-label formulations or the over-the-counter medications, they contain very high potency steroids, which shouldn't be used for more than 2 weeks over the face. But since the patient starts seeing very good results and they see, oh my God, all my the pigmentation is gone and all my acne is gone, so let's keep on using it. And they don't see that eventually in long run, they're harming the skin a lot.
Right. We would also like to understand, Doctor, why our facial skin is so vulnerable for these topical steroids.
See, facial skin is thinner than most of the skin on our body. And the mostly photo exposed or sun damaged skin, which comes in contact with the sun and the UV radiation, is the face. We do, and of course, as very rightly said, the face is the first thing a person notices about someone. I mean, whenever you meet anyone, you will just see the face and you will make an impression regarding that. So everyone strives really hard to keep their face very spotless. And, there shouldn't be any wrinkle, or there shouldn't be any pimple, there shouldn't be any pigmentation of that sort. So yes, that's why. And they don't understand. So by using everything, they're just harming their skin even more.
Right. And that's the whole objective of having this session and getting an expert like you to discuss the importance of how important it is to go and consult a dermatologist, a qualified dermatologist, rather than falling for quacks or saloon-based products or for over-the-counter medication. Now, we would also like to understand, doctor, what are the common side effects observed as the misuse of topical steroids?
All right. See, the side effects, they range and according to the time duration you've been using this corticosteroids. Like if you've been using, I have come across a case you won't believe, who've been using corticosteroid from the past 20 years. And the skin had become so thin. There was so much of erythema, I mean to say the redness over the face. She couldn't go out in the sun. There was so much burning on the face, the eyelids, everything was damaged. So yes, if you're using for a shorter period of time, so you might experience there's something known as acne form eruptions, which is just same size pimples over the face. And you might experience some pigmentation. Initially it will cause a decrease in the pigmentation, it will remove the pigmentation altogether, but then as soon as you stop using the cream, the pigmentation returns. Then there is something known as atrophy of the skin, which comes in long term use. Atrophy means damaging of the skin, and the damaging of the skin can be by the appearance of telangiectasia, which is you must have seen in some patients we see visible blood vessels on the face. It's not because it's not a genetic, some people do have it as a genetic trait also, but it is mostly because of the steroid abuse. The skin becomes so thin that the vessels are visible from within. Then, as you rightly said, excessive hair growth on the skin, which we most commonly see, especially in that young female age group, like from ranging from somewhere around 15 16 years to 30 35 years, even 40 years for that matter. They usually they start using it due to some other dermatosis, and when they see the result is improving, they keep on using it continuously, and as soon as they leave it for 1 or 2 days also, the condition flares up. Then there is something known as post-inflammatory hyperpigmentation and post-inflammatory hypopigmentation. Both the things are seen with the use of long-term use of corticosteroids.
Okay, so these are the common side effects, and
Yes.
all of them are so scary.
Yes,
Nobody would
that's
like to
right.
have these on their face, and the only way to avoid these side effects is to avoid misuse of topical steroids. If you
That's
have
right.
any issue, the bottom line is go and consult the right person, which is a qualified dermatologist in this case. As you very rightly mentioned, we all in our society, we have this obsession for a fairer complexion. We
That's
all
right.
want to look fair, which is not possible in reality. But then there are so many creams, products, brands. I won't name them, but still, we all know that we have been using those creams since ages. And do all those contain steroids? Are they equally bad for our skin?
They do. I mean, I myself had conducted a study in my postgraduate days for the side effects of corticosteroids, topical corticosteroids per se. And I shouldn't be naming some names, but yes, there are very well-versed brands who are marketing their product like anything on the social media, on the TV, on the television. You can see them all the time. And even our elderlies at home, they will say कि अरे अच्छा ये हो गया तो तुम ये लगा लो, हमने भी ये
Right.
लगाया था हमारा ठीक हो गया. That you get that. It's once there's a cream in the family, it goes on to generations and generations till it heals
True.
everyone. So
True.
yes, they contain a good amount of steroid. They mask the names because nobody is now bothering to. Now, of course, the people have become aware. But yes, initially the people did not bother to read the ingredients. They just read whiteness, fairness in 21 days, fairness in 15 days. It is technically not possible to give you fairer skin in 14 days. And there are some great creams which are giving it in even 7 days. So yes, I mean,
Right.
the market is full of such products.
And the problem is कि initially ये creams हमारे ऊपर एक magic की तरह काम करते हैं.
They do.
अगर for example, if I have acne, I'll go get an over-the-counter cream or tube. It will have topical steroid, and the acne will be gone like it was never there. but
That's right.
then I'll get addicted to it. The same happens with fairness creams, or creams who claims to be anti hyperpigmentary creams, etc. So initially वो इस तरह से हमारे लिए एक मैजिक क्रीम का काम करते हैं कि हमें लगता है यही तो हमें चाहिए था, and we in a way feel so proud कि see, without consulting a doctor, without even going anywhere, we have bought something which is working wonderfully on our skin. And that's how we fall into that trap, right? क्योंकि फिर हमारी स्किन को एडिक्शन हो जाता है, और जब हम उसे छोड़ने की कोशिश करते हैं तो इतने सारे इश्यूज आ जाते हैं हमारे चेहरे पे, एक्ने हो जाएंगे, या फिर ब्लैकनिंग ऑफ स्किन हो जाएगा, और बहुत सारी ऐसी चीजें जो हम समझ भी नहीं पाते। जब तक हम एक डॉक्टर के पास जाते हैं, हमें रियलाइज होता है कि अगर हम पहले आते तो शायद इतना प्रॉब्लम होता ही नहीं। बैक टू जीरो पे पहुंचना, जहां से हमारी स्किन ने डिटोरिएट होना शुरू किया था, वहां तक पहुंचना ही बहुत लेंदी हो जाता है। सो व्हेन यू सी पेशेंट्स, बिकॉज यू हैव बीन टेलिंग कि कई ऐसे पेशेंट्स आपके पास आए जो 20-20 साल से क्रीम्स का
That's
यूज कर
right.
रहे थे, तो जब बहुत ज्यादा स्किन वर्जन हो जाती है, वेदर इट्स थिनिंग और फेशियल हेयर्स एक्सेट्रा, तो कितना मुश्किल होता है उसे बैक टू स्क्वायर वन पे ले जाना।
बहुत मुश्किल होता है, आई वुड से। आई मीन, एक चीज जो डैमेज हो गई है, इट्स वेरी डिफिकल्ट टू कम, ब्रिंग इट बैक टू दैट ओरिजिनल नॉर्मल स्किन you had. We all are born with a wonderful skin. Of course, by the teenage time, some people have excessive sebum production, some people have some hormonal issues which causes the skin to deteriorate, or some people have such a strengthness or job which has so much of UV and and sun exposure that they cannot help their skin that much. I mean, you can't expect, when I tell especially the young men, when I tell them you apply sunscreen 3 to 4 times, they're like, "अरे इतना time नहीं है हमारे पास कि हम 3 से 4 बार sunscreen लगाएंगे." और even if I'm giving them something like, there is a compound known as hydroquinone, which is a wonderful drug for, it's a steroid, but it works very well in melasma. But yes, as I said, with discretion. It should be given under the guidance of a dermatologist. The dermatologist will let you know till when to use it, till when to stop it, when to make it alternate days. But once they take the prescription, they go and then they're done. Then the pigmentation goes back. They stop using every cream, and it comes back even with more vigor. It comes back, 3 times more. फिर वो सिर्फ cheeks पे ही नहीं रहता, वो nose पे भी आ जाता है, वो forehead पे आ जाता है, because they were not using sun protection forces that well. Sunscreen makes a very important, it's a very integral part of our care routine. So yes, that is there, and they are it is very difficult, and sunscreen plays a major role in recovering your skin as well. So for my patients, when these patients come, I tell them very frankly, it will take me somewhere around 6 months to 1 year to make your skin back to, even, remotely possible to back to normal.
बिल्कुल। तो हम अपना टाइम वेस्ट कर रहे हैं, हम अपनी एनर्जी वेस्ट कर रहे हैं, हम अपना पैसा वेस्ट कर रहे हैं, हम अपनी हेल्थ, अपना स्किन रिस्क पे डाल रहे हैं when we do these experiments or use these over the counter products or medications etc, do self medication। ये सब हम बचा सकते हैं by going to a doctor, qualified dermatologist at the very first place. And that's why we are having this session, so that we can spread awareness about the misuse of topical steroids and how important it is to go to the right person. Because the doctor actually knows. They have done studies for like 8-10 years, and they are still in the process of learning. They are still learning. So please go and consult the right person, because
There's a specific terminology we have, that is TSDF, topically steroid damage phase, which has been coined by IADVL. I mean, it has come as a proper, as a proper terminology. Yes, whenever these kind of patients come to us, we make the diagnosis under the heading of TSDF, that is topically steroid damage phase. So the topical steroid rampant uses that rampant.
And then we also have, creams for hyperpigmentation issues. We also have topical steroid misuse cases in the case of acne. Melasma and hyperpigmentation, again, because it is very common in our society,
That's
especially in women. And again, we don't like going to the doctor at the first place. We first like to experiment. And the first thing that we do normally is to consult a friend or family who have the same thing. We can even go with their prescription, what they followed, वो क्रीम्स और हम परचेज कर लेते हैं, लेकिन चूंकि हमने डॉक्टर को नहीं दिखाया, तो एक तो डायग्नोसिस डॉक्टर ने नहीं किया कि हमें ये क्यों हुआ है, प्लस हमको ये नहीं पता कि ये कितना लेना है, कब लेना है, कब नहीं लेना है, तो हम बस उसको यूज करते रहते हैं। ओवर द काउंटर मेडिकेशन तो है ही। तो melasma again, because it is very common, we have so many over the counter products claiming that they can treat melasma or hyperpigmentation, how bad they could be, and why it is important to go and consult a doctor at the first place.
I'll tell you what, as you very rightly said, कि आपके family, friends, they become the first doctors, but उससे बड़े doctors are the chemist.
Right.
They are the biggest doctors. I mean, you come, I see it so many times कि the patients come to me कि वो chemist ने हमें ये दे दी थी medicine and हमने लगाना शुरू कर दिया. As I said before also, the strength of the steroid and the duration of for which you are using it is very important. If you're using a very high potency steroid for a longer duration, the side effects which were happening with the lower potency steroids in 2 months will start happening in 1 month only with you. And initially, as I said, it is a magic. These creams are a magic. They just disappear all your dermatosis of the skin, be it your melasma, be it your acne, be it your any fungal infection or any other dermatosis for which we are treating them. It will vanish it away on the face. But as soon as you stop it, then they start seeing the pigment. Firstly, they'll see redness, then they'll see burning. Firstly, they'll see burning, then they see redness, and then there'll be the return of the pigmentation with even more vigor. So yes, do consult your dermatologist, because not all melasma cases are only skin deep. We have to take care of all the things going on in your body. Melasma is also associated with a lot of hormonal disorders, so we need to take that into account also.
Exactly.
I mean, they can apply n number of creams. We can give them a number of creams, but if we are not investigating the root cause of the disease, we cannot treat the disease properly. So
And
that's why
again,
it's very
as you
important.
mentioned about the chemist and how they become the doctors, or
That's
how
right.
we make them our doctors or consultants, is that acne के लिए भी, again we'll go to the chemist shop, ask the chemist कि भैया वो acne हो रहा है, कोई cream दे दो. He'll never tell us what type or what grade or are these acnes, or what
That's
is the
right.
reason behind, because of course they are not the doctors, they are not going to conduct any test. They'll just look into it. Even without looking at it, they'll give you a cream, and you won't even realize that it's a steroid and it's going to be really bad. लेकिन लोगों को ये लगता है कि एक्ने तो छोटे छोटे हैं, वही वही हम अप्लाई कर रहे हैं, तो वो हमारी ओवरऑल फेशियल स्किन को कैसे डैमेज कर सकता है अगर वो स्टेरॉइड्स है भी तो. So what's your say on this, doctor?
My say on this is, acne is a bacterial infection, and bacterial infection is never localized in one place. You can see some aggregates, like a lot of patients they come who have acne only on the forehead or on the cheeks, but it is affecting the entire skin. Your entire skin is becoming oily and producing sebum. When you are applying steroid, it will clear that acne, but it is spreading to the other areas of your skin as well, and it is not treating the root cause. So if like they're applying it on cheek, so few days later they'll see something on the jawline, then they'll apply it there also. So slowly it is on the entire face. And as I said, as soon as you stop, or as soon as they even a lot of patients, even during applying steroid, they see the return of their acne. But the problem now then occurs because we cannot give them the right ingredients. The skin is so inflamed, the skin is so damaged. We have to repair the skin first and then give them the correct treatment.
Then how do you taper down the use of steroids? Because you may also prescribe steroids,
That's
right?
right.
You also do, but then you know how much dosage is important, how to taper it down. अगर मैं already 15 सालों से steroid cream use कर रही हूँ, जिसका मुझे पता भी नहीं था कि वो steroids है उसमें, अब मैं डॉक्टर के पास गई, तो definitely you will try to taper it down. एकदम से तो हम नहीं बंद करते, because then it will start showing other effects. किस
That's
तरह से
right.
आप taper down करते हो?
See, what I do generally in my practice, I tell them, okay, I give them a very lower potency steroid just to cover the inflammation first, because a steroid works very good on the inflammatory part. And I give them some oral antibiotics or oral drugs according to the cause which I've investigated with them. Then gradually I repair the skin with moisturizer and sunscreen, judicious use of moisturizer and sunscreen, and also take care of the acne through oral medications. It is of course a gradual process. As I said earlier also, to repair a steroid damaged skin, it takes somewhere around 6 months. to let the skin return to normal, the normal texture and the normal color of the skin. Even sometimes there are times when we cannot return the skin to the normal texture and color because it is damaged to that extent. So
Right.
you have to treat it as a whole. It's a disease. It's not just one acne or one pigmentation point. It is a disease. We have to treat it as whole.
Right. And plus the use of sunscreen becomes even more important.
Very important.
Okay.
And actually,
Now,
I would also, I'm sorry,
yes.
I would also say the use of right products. Not every product, not every ingredient is meant for every skin type. So that is also very important, and that is what the dermatologist will only tell you. Okay, you have an acne prone skin, you don't use this. You have a dry skin, you use this. So that totally depends on your dermatologist.
Exactly, that's the whole thing. Our skincare regimen, what to use, what not to use, which formulation is good for us, which is not, is very technical. It depends on our skin type and depends upon various other factors. It also depends कि हमारे को कोई और दिक्कत तो नहीं है, hormonal imbalance है और तो कुछ नहीं है. तो इसीलिए
That's
बहुत
right.
जरूरी है कि हम एक qualified dermatologist के पास जाएं. एक तो ओवर द काउंटर मेडिकेशन या प्रोडक्ट्स एक इशू है डॉक्टर. दूसरा आजकल इतने इन्फ्लुएंसर्स हैं एंड वी ऑल आर ब्लाइंडली फॉलोइंग देम ऑन सोशल
That's
मीडिया. Now, many times most of the time, these influencers are not qualified doctors or they don't have a degree, they don't hold an MBBS or an MD in dermatology, etc. But they'll keep on giving lessons on how to take care of your skin, how to get rid of the melasma or hyperpigmentation, how to take care of acne, etc. And they are in a way also endorsing products. So हमें नहीं लगता, पर हमें लगता है कि ये तो बिल्कुल customized products हैं, this is good for us. So my question is, because we are not only buying a product from a chemist shop, chemist से तो एक बार शायद को हम पूछ भी सकते हैं कि इसमें steroids तो नहीं है, तो शायद वो हमें देख के बता सके. अगर अवेयरनेस हम की बात करें कि एक लेवल पे अवेयरनेस आ गई है, क्योंकि ये सेशन सुन के ओवर द नाइट एक रेवोल्यूशन आ जाएगा और ओवर द नाइट लोग केमिस्ट के पास जाना, ओवर द काउंटर प्रोडक्ट्स इस्तेमाल करना बंद कर देंगे, ये नहीं होने वाला है. पर आई थिंक
that's right.
एटलीस्ट ये हो सकता है कि अगली बार मैं एक क्रीम लाने जाऊं तो मुझे पता हो कि ये स्टेरॉइड बेस्ड हो सकता है, तो मैं एटलीस्ट पूछूं. और इन्फ्लुएंसर से तो शायद वो पूछने का भी एक ऑप्शन नहीं होता. Are there any ingredients or steroids that we should be aware of or we can check while buying a particular product? एक तो definitely है कि हमको डर्मेट के पास जाना है. इन केस अभी भी हम नहीं जा रहे हैं और प्रोडक्ट्स ले रहे हैं, क्या उसमें हम कुछ ऐसे इंग्रेडिएंट्स हैं जिनको देख सकते हैं, और अगर वो हैं तो उन्हें हम ना लें?
See, like there is something in melasma के cases में if we talk, so there is something known as triple combination. ठीक है. Triple combination is like a combination of isotretinoin, of a steroid, and a lightening agent. See, so we need to take care. We do give. I also give it in my patients for initial relief. But yes, as I said earlier, also, okay, we have to take care of the duration of how much we are giving it, and also how much to apply. That is also very important. You have to apply a pea size, or you have to apply it, a huge layer on your skin. So that is also very important. Second of all these combination creams which are coming in the market, I mean, I shouldn't be naming them, but yes, there is something known as Skin Shine, Skin Light, Castor NF, Betnovet N, all these creams, Betnovet C, all these creams, we've been hearing them since we were children. I mean, ये वही है जो हमारे पेरेंट्स के भी उसमें थी कबर्ड में कि ये लगा लो, इससे सब कुछ ठीक हो जाएगा. So yes, these are the creams, and especially combination creams, you should be very aware about them. Any influencer who's telling you, they cannot tell you what kind of skin you have. A lot of people have a combination skin. They have a dry area as well as and there is an oily area. If they start using products for dry skin, their skin becomes over oily, and the oily area usually starts to get acne. Similarly, in pigmentation cases, the pigmentation may not be that much, but yes, they are applying such harsh creams on their faces that it is damaging the pigmentation as well as the surrounding skin. So yes, these are the major brand names which you should be very cautious about. And high potency drugs, high potency corticosteroids, sorry, super potent and high potency corticosteroids, specifically those names like clobetasol, halobetasol, these should be avoided.
फेयर इनफ। और कई बार होता है ना कि एक्ने हुए हैं, एक्ने तो ट्रीट हो गया, लेकिन एक्ने जो पिगमेंटेशन मार्क्स छोड़ के जा रहे हैं, जो स्कार्स छोड़ के जा रहे हैं, वो कई बार हमको लगता है वो ज्यादा मुश्किल है ट्रीट करना। और ऐसे में हम जो बहुत सारे ऐसे क्रीम्स है, अगेन ओवर द काउंटर, जो ये दावा करते हैं कि दे कैन रिमूव दी स्कार्स, कुछ और भी अगर फेस पे आपके स्कार्स है, दे रिमूव इट। अगेन, डू दे कंटेन स्टेरॉइड्स?
Not necessary, I would say. Some of them do contain some good exfoliating agents or lightening agents like glycolic acid, lactic acid, or arbutin. These are good, lightening agents also. I won't say that all the creams are bad. All the things which are coming in the market now, the public and even the companies have become very aware. We have proper dermatologically approved products on OTC counters, which you can take. Even I prescribe my patients all these things. But yes, which ingredient is suitable for you and for your skin condition should be decided only by a dermatologist. That is all I'm saying.
So currently I have 3 questions from 3 viewers, and all the 3 questions are based on skin whitening. So that proves that I was correct when I said that we have an obsession for skin whitening or fairer skin. Anyways, I'll take them one by one. So Advik Singh is here. His question is, are there any natural remedies or home remedies for skin whitening? Because people keep on, experimenting a lot. But I would like to add to it, doctor, if you can tell us something that we usually do in the name of home remedy, but which is actually harmful for our skin.
Okay, I always say do not exfoliate too much. Over exfoliation harms your skin a lot. All these fancy products which are containing those tiny little beads in them, and you keep on scrubbing them, or whenever you go to a salon they tell you कि अरे clean up करा लो, बिल्कुल face चमक जाएगा. Of course चमक जाएगा, but once you start doing it at home, when you you bring those scrubs, you bring those exfoliating gloves and everything at home, because you're opening the pores, you're cleaning them well and good, but you're not closing them, and that leads to what nowadays we are getting, कि हमारी skin पे pores बहुत हो गए हैं, छोटे छोटे, ऐसा लगता है कि छोटे छोटे बहुत सारे छेद हो गए हैं. It's nothing but just your pores which were supposed to be closed, now you've opened them. And similarly with acne scarring, with acne scarring also, that is the case. They keep on applying some funny remedies, and then they come to us when they've burned their face or done anything like that. We have few creams which do help with pigmentation also. And in cases of home remedies, I'd say yes, turmeric does have a very good effect on the face. In pigmentation, especially in periorbital pigmentation, I've seen the use of potato in home remedies is very good. And rest, I'd say don't rely too much on them, because they tend to dry out your skin also. Once in a while it's good, you can apply, but yes, go to a dermatologist. They will tell you also some remedies.
Exactly. Maybe you are allergic to something, you don't know, you start applying it, and that's how it harms you more. So please consult a doctor before experimenting even. Swastik Mishra, his question is, will skin whitening treatments make my skin more sensitive to the sun?
See, I won't say it's only skin whitening treatment, anything. And nowadays, thanks to the, the ozone layer being shifted to a side and everything, the sun is very harsh. You always need a sun protection. You always need sun protection. It should be physical, it should be chemical, it should be all types. We nowadays prescribe in this weather, it should be a sunscreen which is physical and chemical both, because you need that layer. And yes, once you start any kind of treatment, you always have to maintain it. And what better than to maintain than just apply a sunscreen 2 to 3 times a day.
Right. Yeah. N number of questions are coming on skin whitening. What I would like to ask you, Dr. Aliza, is it even possible, skin whitening? I mean, if I have a whitish complexion, can I become fair?
See, it's technically not possible to just to change 3-4 shades of your skin. Yes, you can lighten the skin, firstly because a lot of times the skin is damaged because of, as I said before, because of sun, because of some chemicals, or because of your work profile. I mean, you have too much of screen time in your job, so every time whenever you're taking all those rays on you, so the skin is becoming disfigmented, I would say.
Right.
So yes, you can change that. And now the upcoming treatment, which is not exactly US FDA approved, but yes, people are doing it. That is the use of intravenous and oral glutathione. It does improve over a long period of time because it's a wonderful antioxidant. It does improve your skin tone by the shade of 1 or maximum 2, but there is nothing like,
Not beyond that.
yes,
Right.
yes, you cannot do that. I mean, and whoever is doing it, please.
Right. And I think every skin tone, every skin color is unique and beautiful on its own. And I think we should focus more on a healthier skin, because skin is the mirror of our, what is going inside us. So a healthy, even toned, or less sun damage or no sun damage should be our focus. But here, mostly people are focusing on skin whitening. But nevertheless,
that is the most common indication I get nowadays. I mean, especially in that age group where the girls are going to the school and the colleges and they're becoming tan, and the mothers come and they're very upset कि अब इसका क्या होगा, शादी कैसे होगी. I tell them that it's very important to have a clear and a radiant skin. That is most important, because that shows how happy you are inside also.
Right. And with what you just discussed, right, throughout the session, I think it's more important to use a sunscreen than using a fairness cream, because it will actually, yeah. So we would like you to, shed some more light over the use of sunscreen, especially if you have already done a lot of damage to your skin, or even if you have not done anything as of yet, but you are looking forward for a fairness cream or something. How important could be a sunscreen?
Sunscreen gives you a beautiful layer on your face. Nowadays, we have so many sunscreen. We have tinted sunscreen. We have physical sunscreen. Initially, we did not have so many variety, but thanks to the tinted sunscreens, even the female who want to go for jobs every day, they can have a good coverage over the face with a hint of foundation, so they can look spotless and beautiful all day long. Firstly, and secondly, any damaged part, any damage which is done by anything, be it steroid, even I'd say if somebody has a burn on their face, if somebody has any kind of dermatosis on their face, the skin tends to become more photosensitive. So sunscreen is of utmost importance. And I tell my patients, if you apply sunscreen, you can very easily get back to your natural color, even if you're tanned or you have some pigmentation. Any kind of treatment which I give or which any dermatologist give, we always emphasize on the fact that you use a sunscreen to maintain that glow. We can give you the glow, we can take care of your your concerns, we can take care of your pigmentation, your acne, but once it is treated, you have to take care of yourself by applying a good sunscreen to not to let those things return back to where they were. So sunscreen is that important.
Exactly. So sunscreen is very important. One more question from our viewer, Santosh Kumar. Are there any lifestyle changes or dietary recommendations that can enhance skin whitening results?
Yes, it is. I mean, you can use a good quantity of antioxidants in your healthy lifestyle through your diet. We have now we have a lot of products which are coming in formulations of a powder or a capsule, which you can take. As I said, glutathione is a wonderful antioxidant. You can take it in form of tablets or nano shots or intravenous if you want. I mean, that depends totally on your indication, on what kind of things you want. And the lifestyle modification, as I've been saying throughout the session, please do apply a good sunscreen.
Right. And Dr. Aliza, before we sum up the whole session, any concluding note, any take-home message for our viewers?
Yes, of course. See, steroid is of course good, and we do give in some dermatosis, but let that discretion be with your dermatologist and not you, and not with any family friend or any chemist. Your skin is different from anyone else, so let your dermatologist be the judge of what kind of treatment and what kind of ingredient will be suitable for your skin.
Right.
Don't let the influencers and the advertisements or anything influence you when it comes to your face, because as I said in the opening of the session, the face gives the first impression.
Right. True. And जिस तरह से ड्रग होता है ना, हमें शुरुआत में ड्रग्स अगर कोई नशा करता है तो उसे बहुत अच्छा लगता है, फिर एडिक्शन हो जाता है. ये वही ड्रग है जिसका इस्तेमाल दवाइयों में भी किया जाता है, जो जान बचाती हैं, लेकिन देन वो एक्सपर्ट्स करते हैं, वो साइंटिस्ट करते हैं और बहुत लंबी रिसर्च के बाद करते हैं. तो हर चीज का अपना, अगर आप उसे गलत तरीके से इस्तेमाल करेंगे तो मिसयूज होगा और उसका नुकसान आप ही को उठाना पड़ेगा, और सही जगह से अगर आप उसका इस्तेमाल करेंगे तो वो आपके लिए अच्छा होगा. तो in case of any doubt, please go and consult a qualified dermatologist. Don't fall for quacks or influencers, etc. And a big no-no for over-the-counter products. So please go and
That's right.
consult a dermatologist. Thank you so very much, Dr. Aliza, for your valuable time. It has been a very informative session for our viewers, I'm sure. Thank you so very much.
Most happy to help, and I'm really thankful to this platform because it is spreading awareness about such important things. I mean, people don't usually take that, as you said very earlier, the influencers are making videos on the ingredients, but what to prevent the damage is what you guys are doing. So I'm really happy to be part of this session. Thank you so much.
Thank you so very much, Dr. Aliza. And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a good day ahead. Goodbye.